If your doctor told you to start exercising for your diabetes, but you're not sure what to do, keep watching this video. I'm going to break down the cardio and the strength training guidelines for people with type 2 diabetes and discuss some of the potentially confusing part of the guidelines. I'm Dr. Elise Brown. I'm a scientist who studies how exercise helps to prevent and slow the progression of diabetes. The exercise guidelines that I'm going to be going over today, they were published in a consensus statement by the American College of Sports Medicine, or the ACSM, back in 2021. Now, there's a lot of different types of exercise and physical activities that can help to improve diabetes, including glucose management, but we know the most about structured exercise because that's what's been studied the most in research. The first type of exercise that I want to talk about is cardio, or aerobic exercise. So this is going to be continuous movement of large muscle groups in a rhythmic way. This is going to include activities like walking, jogging, biking, swimming, dancing, rowing, and similar types of activity. The intensity that you want is going to be anywhere between moderate to vigorous. So with the moderate, you want to make sure that you are breathing harder than you normally would. And to stay in moderate, you can typically carry on a conversation with somebody. If the intensity starts to get so high that you can't carry on a conversation, that likely means that you're working at a vigorous intensity. As I start to talk about how long you should exercise, how many days a week you should exercise, and other programming recommendations, keep in mind that you're not supposed to be hitting all of these recommendations in week 1, and maybe not even week 4. You need to start off light and start off slow and gradually build based on where you're currently at. You want to make sure that you're doing cardio anywhere between 3 to 7 days a week, and you don't want more than 2 consecutive days to pass without doing cardio. If you mainly do moderate intensity aerobic training, then you're going to need a minimum of 150 minutes per week, and each exercise session should be at least 10 minutes long. Now, if you mainly do vigorous cardio, like high intensity interval training or HIIT, then the minimum amount of minutes that you need each week is going to be 75 minutes. And you can do a mix of different intensities, so getting some of your minutes each week from moderate and some from vigorous. You can progress in your program by gradually increasing the intensity of what you're doing, the number of minutes that you're spent doing cardio, and the number of days per week that you're doing this type of exercise. If you follow just these recommendations without making any other changes to your lifestyle, in most people, they'll see a reduction in their A1C by about 0.5 point or 0.75 point. If you have other health conditions that prevent you from getting in these minimum recommendations for cardio, then just do whatever your physical and your mental health allow you to do. Please hit like and subscribe if you're finding this useful.